Hello, welcome to ANA community. In this particular video, we are going to discuss the another part of the general examination, that is examination of mouth, which contains lips, gums, teeth, palate, and oral mucosa as such. From the past several videos, we are discussing about the general examination, sequence of general examination, significance of general examination, and regarding the certain examination of the different body parts of the body parts, where the examination of them will be helping us in making the clinical diagnosis. In this particular video, we are going to discuss the examination related to mouth. As far as examination of mouth are concerned, first of all, we need to know about the brief functional anatomy of the mouth. This is the image of the oral cavity, including mouth. So this is considered to be the upper lip. This is considered to be the gums. And below that, that is the teeth are there. And this is considered to be the palate, which is having again two types are there, hard palate and soft palate. And the soft palate, that mid portion of the soft palate, at the back side, this is considered to be uvula. This is tongue, and this is considered to be the just behind the on the either sides of the uvula. We are going to have the swelling. That is what we can say. That is the tonsil, and then comes the teeth again. Then comes and the lips. So of course, the upper lips are mainly related with the maxilla, and the lower lips are related to mandible. With this brief anatomy, we are going to look into some of the abnormal findings that may be observed in these different body parts, in these different parts of the mouth. This is considered to be the ulcer which is being seen in the mouth. This is considered to be aphthous ulcer, and this may be observed in vitamin deficiency, specifically the B12 deficiency. And if it is having the cauliflower-like growth, then it may indicate oral malignancy also. This is considered to be the see on either sides of the mouth itself. See this, there is a one particular ulcers are there. This is being termed as angular stomatitis. This may be observed in case of ill-fitting dentures. If the person is having the artificial dentures, if they are not properly fitting, then this may be developed. It may also be seen in vitamin B12 deficiencies, in case of some of the fungal infections, oral candidiasis, etc. In case of anemia, diabetes mellitus, chronic eczema, and atopic dermatitis. In all these situations, the person may have angular stomatitis. This is considered to be the discoloration observed on the center, on the front portion of the lips. This is what is considered to be the nicotine stains. So the person who is having the habit of the chronic smoking, a chain smoker, in those conditions, you are going to have this particular nicotine stains as such. This is considered to be cleft lip, which is considered to be a congenital malformation. It's a birth defect, which is indicative of the improper embryological development. This is considered to be the deviation of the lips on the left side. So that means he is, or this particular lady is having the what do you say, that the facial palsy, on the right side. So this is supported by, this is what we can say, the this is what is considered to be nasolabial fold. So here on the left side, this is very prominent. On the right side, this is considered to be obliteration of nasolabial fold is being present. This is an indication of the facial palsy. So this particular disappearance is considered to be due to the loss of the muscle tone on the right side. Whereas on the left side, the person is having the absolute normal muscle tone. This is actually pulling the uh, this one, mouth on the sound side. This is indicative of as we have mentioned earlier, the Bell's facial palsy, which may be observed in case of UMN facial palsy as well as LMN facial palsy. This is considered to be angioneurotic edema. When the person is having some kind of the allergic reactions, as this is being mentioned, hypersensitivity reaction. Suppose if the person is consuming any of the substances which is having the immediate irritation in the mouth, this may be angioneurotic edema may be present. In case of severe forms, this particular angioneurotic edema, there may be a possibility of the closure of the epiglottis as well as the glottis also. Thereby, there may be a possibility of the life-threatening situation. This is considered to be hypertrophy of the gums are seen, and on the 3 different locations, we are seeing the bleeding also, which is considered to be scurvy, vitamin C deficiency. When you see about this, this is considered to be cleft palate. The palate, we are going to see when you see the oral cavity, the two in the palate region, we can see the nasal portion also. Again, this is considered to be a congenital malformation. That means the birth defect, that means due to the birth developmental defect observed in the fetal development. This is considered to be dental caries. 3 different locations are showing this, indicative of poor dental hygiene. This is seeing the nicotine staining of the teeth. This is indicative of the person may be a chain smoker or chronic smoker. In this particular example, see the deviation of the tongue is being observed on the left side. This is indicative of the presence of left-sided 12th cranial nerve palsy. When you think about this, this is considered to be the cauliflower-like growth observed in the oral mucosa, indicative of oral cancer. This is considered to be the upper teeth, the 2 incisor teeth having the gap between the 2 teeth. This is considered as Hutchinson's teeth, and it is being considered to be a sign of congenital syphilis. Syphilis is a sexually transmitted disease. When this is transmitted from a placentally, then this may be one of the signs that can be seen. So here, when you see about this, this is considered to be the enlarged tonsils. On the either sides, you can see the overgrowth of the tonsils, may indicate the infection in the oral cavity. This is considered to be the deviation of the uvula. That is what we can say on the left side. This is considered to be uvula. Deviation of the uvula on the left side. This is indicative of the right-sided 9th or 10th cranial nerve palsy. So when you think about the take-home messages from today's discussion, the mouth or oral cavity examination is considered to be an important part of general examination. Whenever if you are observing the mouth, lips, gums, teeth, palate, tonsils, uvula, tongue, and oral mucosa should be examined in the proper manner, because each of the abnormal signs observed in these regions having the clinical significance in identifying the probable pathological events happening inside the body. For example, nicotine stains in the lips may indicate the chronic chain smoking. Cauliflower growth in the oral cavity may indicate oral cancer. Deviation of the mouth to the normal side may indicate facial nerve palsy, or bleeding gums may indicate vitamin C deficiency or scurvy. Dear ANM members, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days? Mention in the comment box below. And spread this particular video to maximum number of true Ayurveda learners or true Nidana learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.